Well, the public is invited to attend a town hall meeting coming up on February 13th at the George Family Education Center at Crossing Rivers Health. This will begin at 6:30 in the evening, talking about addiction and the impact that it's having on Crawford County, Prairie du Chien area as well. We're joined by a number of guests who are going to be involved in that town hall event. Lynn Ryder, she is the Crawford County Circuit Court Judge. Also, Rick Peterson, he's the Crossing Rivers South Community Resource Director. And we're also joined by Dan McWilliams, Director of Crawford County Health and Human Services. So we'll say hello to you. And first of all, we'll start with you, Lynn. When it comes to addiction, how are you seeing that show up in the court system right now? What are we seeing here in Crawford County?
We're seeing the majority of the cases that we see in court are drug cases, and we have seen an exponential growth in cases, particularly felony cases, due to methamphetamine and other drug use, and lots of repeat offenders that have alcohol addiction as well.
Mm-hmm. When it comes to methamphetamine, of course, we've had plenty of news stories about different police investigations into methamphetamine. I guess why methamphetamine in particular? Why are we seeing a rise in that here in the area?
Really good question. I don't know the answer to that other than to say certain areas are seeing different drugs. Or, for example, the opioid addiction we're hearing a lot about in other areas. That's just starting to be on the rise in our area. Methamphetamine used to be popular, so to speak, because people could make it, but now they're not making it. They're bringing it in from other areas and reselling it. So I can't explain why the increase in use, but it's certainly been problematic for several years, but in particular in the last few.
You mentioned the traffic of it, bringing it into the area. What has changed in the last few years in that regard, to your knowledge?
I just am going by what I've heard from law enforcement, that they can bring it in from outside the area, even Mexico and other places, cheaper than they can make it. So that has been the primary source of the substances that they're seeing on the streets. But law enforcement is better able to answer that.
Sure. Now, when it comes to when a case does get to court, how does that proceed when it comes to, because obviously there's addiction involved here. How do you like to see things proceed when it comes to potentially the treatment and reintroduction to society of folks that have been addicted by these?
The problem that we're running into is the people get arrested, and then they are either placed on probation or they're out on bond, and they continue to use. And they are reporting that they're not getting enough support in the community, so we sober them up in jail and let them out, and they go right back to using. They go back to the same network of people and the same concerns that they had before they were put in place. So we're working on a treatment court, which is going to change the focus, hopefully, for criminal individuals to addressing their triggers for why they're using, try to address the addiction, in hopes that through treatment they can become sober and stay sober and not reoffend. But we're addressing this town hall meeting to go to larger group than just the criminal individuals, to people that have issues that need support in the community for their recovery, whether it be alcohol or some other substance. We hope to come up with more support groups, more opportunities for employment, places that they can rent for housing, lots of support needs that these people might have in the community, and we're hoping that the community will respond and that we can all look at this problem and see if there are other things that we might be able to brainstorm about, or other ways that we can try to beat this problem.
Lynn Ryder, Crawford County Circuit Court Judge, one of the featured speakers at the Addiction Town Hall event that will be happening February 13th in the George Family Education Center at Crossing Rivers Health at 6:30 p.m. Also one of the featured speakers, Dan McWilliams. He's the Director of the Crawford County Health and Human Services. Dan, what's your perspective? What do you see from your organization's perspective, or the part what you're involved with, when it comes to addiction and how it's affecting residents here in Crawford County?
Well, I think we've seen some of the same things that the court has as well. We've seen an increase in substance abuse and substance addiction affecting the families that we deal with. So on a child protective services, adult protective services, and in our mental health clinics, we're seeing an increase in the percentage of people that need that kind of treatment. And at the same time, we've seen a decrease in the amount of services that are available to address that.
When it comes to the impact on families, give us an idea of how addiction can impact a family, you know, whether it's a parent or someone else that's related. How does that play out?
Sure, when somebody is struggling with addiction, that becomes paramount to kind of feed that addiction, and some of the roles that they need to fulfill within the family go away. So they're not as effective at parenting, they're not as effective at nurturing their children, they're not as effective at meeting their own basic needs as well. And so they continue to struggle, and then we get involved for one reason or another, and then it's really a hard road to recovery.
Yeah. So in addition to issues with the family, I mean, addiction plays itself out in so many different aspects of a person's life, of a family's life, or maybe some other areas that it can have a real impact on quality of life for that person and the people around them.
Well, I think that addiction doesn't just affect the person. I think that it also affects friends, family, and anybody who's trying to help them as well. And I think that we've seen that across the age span, across the lifespan, I should say. And so even in our adult protective services system, so you're talking about individuals who are 60 and older, we are starting to see an increase in people who are struggling with addiction to painkillers, addiction to alcohol, and to the point where they need to have intervention from social services to be able to meet their basic needs.
Let's talk about the support systems that may be in place through health services, things like that. What is available?
So when somebody is struggling with addiction, typically they're going to have a gamut of services that will help them, and sometimes that is outpatient, sometimes that is what's called residential treatment, where they actually go to a place and they stay for a period of time to try and get intensive services to be able to help them with that. But what we've seen is that whether it's residential or whether it's outpatient services, there's really not an availability or an abundance of those services in our immediate area. And even when you go as far as La Crosse, you're not seeing that there's access to all kinds of services. I think that we've talked several times in this group that even for residential services, for example, while there's a shortage of those beds, some of those beds are not full either, and that comes down to funding and reimbursement. So there's all kinds of issues with the treatment system that aren't helping this as well.
I know addiction, and especially opioid addiction, has gotten a lot of attention at the state level. What are some of the factors that need to be overcome, especially in a rural area like we're in, maybe compared to a larger city in, say, like Madison or Milwaukee?
I think that some of the issues are the same. I think, we are a rural area, so there's not as many opportunities for formal services, but also informal supports with that. But even in a larger community, you may see that it's kind of a economies of scales issue, where there's more people who need to access services. So as I meet with fellow directors across the state from different areas, the same issue seems to be out there, that it's not just opioids, it's alcohol, it's methamphetamines, it's other types of addictions that really aren't getting addressed.
When somebody has a problem with addiction, does that person realize that they have a problem with addiction and then they seek help, or is it usually a family member, a friend, or somebody that says that pushes them in that direction? What do you normally see?
Well, I think we see both. At our agency, we will have people approach us and say, I'm struggling, and I know I'm struggling and I need help. Sometimes that's because everybody around them has said you need help, but a lot of times I think there's a realization before even that occurs for people to think that something's not going well. Yeah. I think that's one thing that we're trying to get with this town hall is there's lots of ways to get to help. And for somebody it might be an AA meeting or an NA meeting or smart recovery. For others it may be treatment.
We're talking with Dan McWilliams, Director of Crawford County Health and Human Services. We're also talking with Lynn Ryder, Crawford County Circuit Court Judge. The Addiction Town Hall event comes up on February 13th, 6:30 p.m. at the George Family Education Center at Crossing Rivers Health. We'll bring Rick Peterson, Crossing Rivers Health Community Resource Director, into the conversation real quick. Just tell us a bit more about the event. This is open to the public. We're looking for public input with this. Tell us what people should be coming and expecting to get out of this event.
Well, I think it's an opportunity for the community to get involved, not only in support for whether it's recovery people, identifying addiction, and friends and family. But it just takes everyone to be involved. When Dan was mentioned, oftentimes a lack of providers to deal with people with alcoholism, some other addiction, or mental behavioral health. And we've been able to help some of that through the use of telemedicine, where we're using psychiatrists located off-site or off-campus to provide help so people can get in quicker and see someone and begin a road to recovery. But it's supporting that person in recovery and realize that with the community's help, they can make a change in their life, because it is really, it creates a burden on everybody in the county because of the crime, because of the usage, lack of family support, as Dan was mentioning. So encourage anyone to come if you want. You don't have to, sign up in advance, but if you want to, you can call Lynn Groom at 608-357-2285, just so we have a good idea of who's coming and be prepared for it. And again, everybody, all ages, are welcome to attend because it impacts everyone.
Lots of different agencies, featured speakers involved here, and of course community input as well. A really collaborative effort by everyone in the community, because that's really what it's going to take to overcome, these addictions and in some cases crises for some of these things. I guess what's the, if you could see things playing out in the best way possible, how do you see things playing out as far as helping to maybe trend things in the positive direction when it comes to overcoming addiction and abuse?
I think the first step we've already seen, which is a collaboration from the courts, law enforcement, probation and parole, Gunderson Clinic, Mayo Health Systems, Crossing Rivers, Crawford County Human Services. These are the players that routinely see people with addiction issues, and we're all coming to the table together to try to figure out what we can do better, and we want more people at the table. My hope for this is that it's just the beginning of a group that will continue to meet and evaluate this and try to figure out what we can do better. Perhaps it means coming up with sober activities for people in our community. Perhaps it means other groups partnering with us and figuring out ways we can have a center for people to go to get support, or to find out where their meetings can be held. I just can see a myriad of possibilities, but I'm hoping this is just the beginning of further collaboration between all these agencies and members of the community.
Okay. Dan, anything else to add?
Sure, I think what my hope would be is that that we can build on the treatment resources that are there, because when you think about somebody who's recovering, treatment is a very small portion of their time. They need that support outside of the professionals that are doing that in an environment that's going to encourage them to get healthy again. So I'm hoping that that's what the community sees as well, and that they can take a hold of that piece